A peripheral intravenous catheter will be placed in your feline patient. The catheter will be utilized to administer induction medications, deliver intraoperative intravenous fluids, and provide access to the circulatory system in the event of an emergency. In the cat, the cephalic vein is the most common site to place a peripheral catheter. There are a variety of different types of catheters available for use. We will be using an over-the-needle style catheter. These catheters may be left in the patient for 24 to 48 hours. However, in most cases, we will remove the catheter once our patient has fully recovered from anesthesia. The size of the catheter, referred to as the gauge, will vary depending on the size of the patient, the state of patient dehydration, and the rate of fluid delivery. In general, a 22 to 25 gauge catheter is appropriate for a cat. It is advisable to place the largest gauge catheter possible in a given patient. This will afford you the greatest flexibility in the rate of fluid and medication delivery. Have the assistant place the cat in sternal recumbency. Next, the assistant should grasp the cat's head under the mandible and turn the head away from the limb in which the catheter is to be placed. Clip an area of hair over the vein approximately 2 inches by 2 inches in size. If the animal has long hair, it may be necessary to shorten some of the hair surrounding your site. Perform a sterile preparation of the clipped area. Soak 2 stacks of gauze sponges, one in surgical scrub and one in sterile saline. Gently cleanse the clipped area with gauze sponges, alternating between the surgical scrub and the saline. You must scrub for a minimum of 3 rounds. Continue to scrub until you have achieved 2 clean saline sponges. Arrange your supplies for easy access. Remove the protective sleeve from the catheter, being careful to maintain its sterility. You may wish to break the seal on the catheter and stylet by gently sliding the catheter down the stylet a few millimeters. Seat the catheter back onto the stylet. Do not slide the catheter too far down the stylet or make vigorous movements, as this may shear the end of your catheter. Although such shearing may be too subtle to see with the naked eye, the jagged edges will make it difficult to thread your catheter into the vein. Have the assistant occlude the cephalic vein by grasping the limb from the lateral side at the level of the elbow and rolling outward. Steady the limb in your non-dominant hand and visually locate the vein. If you must palpate the limb to identify the vein, avoid touching the area directly over the site you intend to place the catheter. Once the vein is located, you may stabilize it by placing your thumb adjacent to it. With the bevel facing upward, position the catheter at a 20 to 30 degree angle to the skin. Insert the catheter through the skin directly over the vein. After your initial insertion, always pause a moment to wait for a flashback of blood to appear. A common mistake made by many beginners is to redirect too quickly. If no flashback of blood appears, advance the needle a few millimeters and pause again to wait for a flashback. If the flashback is still absent, slowly redirect the catheter toward the vein. Once you obtain a flashback, lower the angle of the catheter and advance it another 1 to 2 millimeters. This will ensure that the catheter is seated within the lumen of the vessel. Next, hold the stylet completely stationary and slide the catheter down the stylet. This is best accomplished by grasping the stylet in your non-dominant hand and using your dominant hand to advance the catheter. It is crucial that the stylet not move during this maneuver, as movement will often result in a blown vein. Once the catheter is fully advanced, gently withdraw the stylet. If the catheter is placed correctly, blood should now drip from the hub when the vein is occluded. Utilizing the proper technique will prevent most of the common problem scenarios. Remember to obtain the flashback, drop the angle of the catheter, advance an additional 1 to 2 millimeters to seat the catheter into the lumen, and slide the catheter down the stylet. Next, let's look at the most common mistakes made by beginners. After obtaining the initial flashback of blood, failure to drop the catheter angle and advance an additional 1 to 2 millimeters will often result in the tip of the catheter remaining lodged in the wall of the vessel. As you attempt to advance the catheter down the stylet, you will encounter resistance. If you continue to push in the face of this resistance, you will kink the catheter, rendering it non-functional and possibly blowing the vein. Another common mistake occurs during the catheter advancement down the stylet. Attempting to advance the catheter down the stylet by spreading the fingers of one hand has a tendency to back the stylet out of the lumen of the vein before the catheter is in place. To avoid this problem, use one hand to stabilize the stylet and the other hand to slide the catheter down the stylet. Once the catheter is in place, have the assistant release pressure from the vein. Attach an injection cap to the hub of the catheter. Using a 1/2 inch wide strip of white tape, create a butterfly tab on the hub of the catheter and wrap the tape around the cat's limb. With the first layer of tape in place, flush the catheter with 1/2 ml of heparinized saline to prevent clotting. Do not use excessive amounts of flush, as it is possible to over-heparinize small patients. Next, take another 1/2 inch wide strip of tape and place it under the hub of the catheter, adhesive side up. Crisscross the tape over the top of the hub and secure each end around the limb. Finally, take a strip of 1 inch wide tape and wrap it around the limb, covering the area above and below the hub of the catheter. To avoid constriction, be certain not to apply the bandage layers too tightly. Because this catheter will only remain in place for a few hours, no further bandage layers will be applied. Once the bandage is complete, occlude the vein and check the patency of the catheter, then flush with 1/2 ml of heparinized saline. The catheter is now ready for induction.